Okay, so today we're going to enhance, already augmented Ingrid's lips here, and they're beautiful. The lower lip, upper lip, the Cupid's bow or the Cupid's peak, everything, filtrums are all great. But we'll see. What are you trying to achieve now?
I just want to accentuate more
the Cupid's peak
the Cupid's bow, and then this side kind of like tends to go in more.
Okay, so we'll focus on to keep everything balanced. So we'll do everything that she's saying about this is called the Cupid's peak. The Cupid's bow is the whole thing, or we can actually enhance the Cupid's bow itself, which is the vermilion border all around. And then we'll inject a little bit more on this side, the upper, and then actually we'll inject a little bit above, because that's also the lip a little bit. And then we are going to keep the ratio of the upper and lower lip. And then this is I'm gonna talk about the golden ratio for the lips, where let me see here, relax. Okay, I can see better now. Perfect. So you could see here that's the upper lip should be a little bit smaller than the lower lip. And then if we go the other side, 1 second. Okay, and then the upper lip is actually, we can even accentuate a little bit more, but it's beautiful. Or if we take it from here, okay, and then take it from here, so you could see that the ratio is 1 to 1.6. And then the lips can also be like 1 to 1.4. So if the doesn't meet 100% the golden ratio, the 1 to 1.6, that's okay. So the ratio is perfect, so we don't have to deal much with that. Open your mouth a little bit. I already numbed here. So what we are going to do is just to go all around and inject a little bit. We're doing Restylane Kysse today, and then we'll go all around and inject retrograde threading, we call it, filler into the lower lip. And again, the main reason for that is that I don't want the upper lip to start looking too big compared to the lower lip, because that will not look natural. Okay, and then immediately I'm massaging. The best time to massage a filler, lip filler, is just by the injector, just immediately after that. In massaging it later on, it doesn't work that great. It's not recommended, because you can move it from where we need it to be. Okay. Again, we're going all around. So each injection is numbing for the area for the next one, because the lip fillers also, or most of the fillers, have lidocaine in them. So that's why I'm advancing. So I already injected here, so that area is kind of numb, relatively speaking, from the cream and from the injection. And then I continue here, and then I'm almost done with the lower lip. Again, nothing too much, it's just nice and easy. And then what I'm going to do, as I said, with the upper lip, we're doing the vermilion border and augmenting a little bit this side and everting it out, because she feels that it goes in more. So this is the vermilion border first. When as injector doing vermilion border, it's up to you. Sometimes it's recommended to go a little bit lower, so that when you inject, if you inject exactly vermilion border, sometimes it just starts sitting on top of it, and that doesn't look aesthetically pleasing. So it's better to go a little, half millimeter lower than the border itself. Some describe it as a column, a pipe where you actually, that's how you know where you are, because when you start injecting, it just fills that pipe and it flows by itself, where if you inject here, it goes all the way down. It depends on how fast. So when we're injecting, we're taking a lot of things into consideration, including the product viscosity, the G prime, the needle we're using, how fast we're injecting. So all that stuff will make a difference when it comes to the spread of, you know, the filler, and also especially the spread of when we do Botox. Sorry, my hand all over your face. Okay, here we go. You're closing your hand. I was just about to say, one of the few patients doesn't close their eyes while injecting. Most people do, including myself. Whenever like I'm getting a facial or anything, I tend, yeah, I close my eyes, then I think relax. I think it tells about your personality. You're always vigilant. Cannot mess with Ingrid. So the other thing I want to talk about here, sometimes people confuse the naming. You know, there's of course anatomical, you know, medical naming for the anatomy of the lips, and there's the common name. So people call Cupid's bow for this, only the peak here. So the Cupid's bow is all around, you know, that's the shape of a Cupid's bow. You know, when if patient tells me they want to enhance the Cupid's bow and the, you know, point here, that's they want to enhance the Cupid's peak, you know, that angle here. But if they want the Cupid's bow, then it's all around, and it is actually the vermilion border. And then we already enhanced the Cupid's bow itself, vermilion border all around, and then she has a beautiful Cupid's peak, so we're gonna enhance it and, you know, a little bit, so it looks really good for the future. You have to be careful as an injector as well. Here you have the columnar arteries, you know, coming from the superior labral artery, so try to be kind of superficial as well in this area like the rest, although sometimes it also goes superficial. So beautiful. And you could see here sometimes I have to inject a little bit into the philtrums, but she already had a beautiful philtrum, and then you have the dip in between. You know, that's a beautiful, it's a youthful sign, because, you know, I'm saying this because, you know, even yesterday I had one of my patients, she came and then she wanted me actually to fill it, and she's a little older lady, and she's thinking, well, it gives her a youthful. Like, no, it's gonna age you more. When this is like whole upper above the lips is all flat, that's actually a sign of aging. So when you have the philtrum up like a hill, I say hill, valley, hill, that's actually a good thing. So I educated her, and then she was fine. And then she's telling me, because I injected her before for the smoker's line, and then she said, oh, you forget this. My nurse, she's a doctor, my nurse, you know, told me that I forget to fill that, you know, and that's what, as injectors and as patients, is why you have to be careful, because you get a lot of advice and criticism from people who don't understand the concepts of beauty and the concepts of anatomy. So it's okay, you know, you can take the opinion of other people, but discuss it with your injector, with your whoever is doing the filler for you, because what they might other people ask you to do or not to do might not be something actually good or natural to do. So what I'm doing now is I'm trying to invert the lip up, okay, and make it, let me see, and then I'll just for this side, the corner as well, I'll give it some support. We're almost done, and you're almost done.
Yay.
And then I'd like to stay in the dry mucosa of the lip most of the time, so that I don't form what's called mucoceles. Or sometimes people, if you do this, we already have them. You see all these stuff here and then here, so we already have them. So if you over inject or inject too close to the wet mucosa, then you can make these bigger, you know, and then they stay forever. People think they are filler, so part of them are filler, but actually they sequester the little filler that is in there, absorbs a lot of water and forms a sac, and it stays there forever. So the way to treat it is just to leave it alone if it doesn't bother you, because most of the time it is really hidden inside and you get used to them. But if it really bother you, then what we do is I usually go inside and aspirate with the needle, you know, as much as possible from that fluid, and then I disrupt the wall of that sac, you know, and I inject the hyaluronidase to dissolve some of the filler that is in there, and then with the dissolving the filler, because the filler is the one who's actually attracting all these fluids, so they become better. Unfortunately, I have like one day, one of my patients, she told me that her dermatologist or someone actually they have to excise and do a little surgery to get them out, which without trying this method first, which is way easier and simpler. So I don't know why. But again, I didn't see the patient from the beginning. Maybe there was a reason, or maybe they tried that and didn't work and they switched. So we're almost done, or actually we are done, but let's clean everything up again, hide the crime scene, because she's gonna work after here. So she does. Okay, now she looks good, and she's gonna be happy. Hopefully, it's very hard to make Ingrid happy. No, just kidding. She's always happy.
That's what my husband says.
Oh, really? In a good way.
In a good
In a
way.
good way. In a good way. She's very
Never
special.
settle, ladies. Never settle.
Exactly. Awesome. Did I squirt a little bit of silver
bit.
gel? That's good stuff. Anyways.
I know. We're gonna prep for the. Are we still doing Botox?
Oh yeah. Okay. So look a little bit. All right. What about the Botox part? Show me what.
My 11s and my forehead. I think we did 6 and 14 last time.
Yeah.
And that worked well for me.
Okay. So that's very very little amount for the 11, and then for 14 for the forehead. It's a good for female, forehead. It's all they recommend is 20. I think 20 is too much. So we'll do the 14. So basically we're treating the forehead. And I call it a balancing dose, because treating the forehead pushes things down a little bit, and then injecting a little bit here, even if we're not treating, this up so it balances it. Okay, so we'll do that.
Yay! Thank good. It's exactly what I wanted.
Awesome.